Welcome to Community Connected Health, where you find your best and you be better. This is Skip Lowe from Iowa. Joining me today is
Colton Storla from Cedar Rapids, Iowa.
Yeah. So this is our first rendition of doing this. Super excited. Known you a long time, Colton. I can say that finally. It used to be a couple months. Now it's more than a couple years, and just an honor to speak what's on our mind, what's happening in healthcare. So this has been kind of your baby. You're the one that made me come here today. So I'm gonna let you kind of
and I wanted the opening line too, but
you get that too. That's your turn now.
No, you got it. You get that one. Maybe you've solidified the full-time job of it.
That's why I work out every day, so I can think of great things in the shower, and that was really how we launched this thing.
Yep.
All right.
But yeah, calling the show Community Connected Health, and it may not make much sense to people yet, but hopefully with some education, people will start to realize what we're trying to do in our community, other communities, in the healthcare world. Mm-hmm. That there's a lot of disconnect and dysfunction. Everybody's a patient. Everybody's probably dealt with the healthcare system or healthcare in one way or another, or has had a loved one, so it touches everybody. And you and I could probably talk about this all day long, so why not launch a podcast?
Yeah, we just have to figure out how to put it into a spring and condense it into 25, 30 minutes here. But I think Albert Einstein was the one that said that doing the same thing over and over is insanity, and everyone's using that line these days. But I guess that makes me a halfway decent broker, because I've been trying to fix this thing over and over and over. And there's a real discipline to this job. And I owe a lot to working with some brilliant people, yourself included, my friend, and working with captains of industry and providers and pharmacists, and just soaking my brain up with the knowledge that I need to have, because I just feel like I was never good at the Rubik's Cube, so this was my second option. And there's just a lot going on. There always has been, and nothing's new except everything when it comes to technology and the changes in healthcare, right? So there's just a lot on my mind. I think we'll probably get a little focused. We got a miniature agenda here, so let's kind of rip through that a little bit too.
Yeah, I mean, obviously with our first episode, we should probably let people know who we are if they don't know Colton and Skip. So maybe if you just want to kick things off, we don't need to start back when you're in diapers, but tell us a little bit about your background, and then I'll reciprocate.
Yeah. Well, I'm going to kind of go back to my diapers, but my first experience in healthcare was my sister suffered horrific burns, and she was out playing in the backyard, and back when you could burn your leaves in cities. She ran up against a fence, and the fence pinned her into a fire. And somewhat traumatizing. Obviously, I was only 4 years old, but I remember. And her plastic surgeon was Dr. Stallings out of Des Moines, and just improved her life incredibly, saved her life. And then at the age of 5, Michael Cody, who was my neighbor, was my best friend. He ended up dying of cancer. I remember going to Blank Children's Hospital and just being enamored with medicine and the caring hand. And I had a great family doctor, Dr. Korn. He was a World War II veteran. And my mom always talked about how he was just a saint because he came over and made house calls. And so I think I had a really good basic concept of what healthcare was from all ends of the spectrum of care. And as I grew up, ended up we're going to jump into college. How about that? So we're going to skip a few years. So was a science major in college, kind of thought about maybe being pre-med, but as I've commonly called myself, I'm a hippie in a suit. I decided to take the path of music, but I still wanted to have a backup plan, right? And I was just fascinated again with medicine and just science and ecosystems and environmental science major. And then, after college, what do I do next? I went to work for a chemical company, kind of in that scientific world, and then I got in the insurance business and went to work with my father, which that was not easy, having his name on my card. And then I just felt like I had other things I could do, not just with my background. I just had a calling and ended up being on an ambulance crew. And as I was entering the insurance marketplace, I just felt like I had a magnet to the healthcare world. And so I started selling health insurance, and started selling group insurance, and like going, where is all this money going? And wanted to get into healthcare economics and just really try to help the providers. Again, with all the background that I just spewed out, I just felt this kind of was my calling, and it felt right. And so it was on an ambulance crew, got to know a CEO over in Grinnell, Iowa, where I live now and raised my family. I wanted that Norman Rockwell life and wanted to see the 4th of July parades and Christmas and yada, yada, yada. I know I'm talking too much here. We're about running out of time on my intro. But
No, you're good.
I'm going to fast forward. And so got to work with the Iowa Medical Society, the Iowa Medical Group Managers Association. So again, it's just kind of a medicine rat, for lack of better terminology, and wanted to know what was going on. And then, of course, we had the ACA that occurred, and just all kinds of acronyms that seem to terrorize us on a daily basis. And so built an incredible crew around me at Bernie Loan Associates, and wanted to get into self-funding and really understand what we can do to contain the cost for healthcare. And then in 2021, I joined Northwest Partners. I got to meet you, and through, I'll just say, a humiliating experience. So anyway, I
We don't need to talk about that.
No.
Maybe sometime.
So that being said, just really the journey began. And I wanted to just kind of unpack what was happening in the healthcare industry. And so really to modernize my discussion points with my clients and figure out a better way and reimagine healthcare, because it really is the single biggest expense that we see for families and businesses. And I watched our communities across Iowa get dismantled, and we have dismantled also our primary care. And we also have less access to medicine. So this big sucking sound that's going into our colleges for college tuition, a lot of it's healthcare expenses that are just being passed through. And so I just felt an urgency. And so when I joined Northwest Partners and started hearing about your new ideas, and through the Health Rosetta world or the Free Market Medical Association, decided that I would really jump into a dark area, which was pharmacy, and really trying to figure out that Rubik's Cube. And it's just been enlightening. So that really is the entirety of my background. I'm sure I missed 5,000 different things I'd love to tell you about myself, but that's kind of why I'm here today, and just share some of the things and the wins that we're seeing, because we're seeing the other side of the coin, right?
Absolutely.
Yeah. So that's me.
Well, 2 questions for you
Uh-oh.
that our listeners may want to know. What's with the suit?
Yeah.
Not everybody wears suits anymore, and we jump on virtual calls all the time, and you're always wearing a suit, and someone's always commenting on it.
Yeah.
So.
Yeah. My dad was a military man. He always told me that your clients are spending money with you, and be dressed for the occasion. I work with a lot of folks in the professional world, attorneys, hospitals, and then I'll end up in a factory. And it's become kind of a shtick.
Yeah.
But I have a lot of suits that are in my closet. My wife is inherently cheap. She's a farm girl, and she said, "You're wearing them all out before I get to dress like you, Colton." So
You also need to talk a little bit about your musician background. You had a little stint playing the drums, still do.
yeah. The reason why I took up
It's
drums.
okay to boost your ego a bit. You're a great drummer.
Yeah, no, I saw my first drum set in 1972 at 4th of July, and I said, that's what I want to do. And just followed that pathway. Just an incredible, enjoyable experience. And so, and then my other joke is that I play drums so I don't have to talk.
There you go.
So I'm going to stop talking, and I'm going to hand the keys to your palace and Let's talk about your background, your
You know,
journey.
well, since you started in diapers, maybe I'll start there. And I feel like we're probably going to learn more about each other doing this too, which is fun because we have only known each other for, a handful of years. But I would say my first introduction to healthcare would be with my dad. He was type 1 diabetic. Grew up with diabetes his whole life and actually lost his license when he was 20 years old because the diabetes started to take his eyesight. So he would have low blood sugars ever so often and, profusely sweat and sometimes pass out and we'd have to call the ambulance. Sometimes my sister and I wouldn't even know that the ambulance is there until we wake up and they're hitting him with a sugar shot to get them back to equilibrium. It was frightening in some cases, but it just started to become normal. And so that was kind of my first introduction to that. And then in high school, I had supraventricular tachycardia, so SVT. I hope I said that correctly. So I found myself at the University of Iowa doing calibrated ablation, I believe is what it was called, where they went up with catheters through my groin to basically, I think, freeze and like a pathway in my heart to shrink it because I was having heart racing after activity because I played all the sports and it would just hit me during a soccer game or a football game. So I was on beta blockers and so that was kind of an in and out surgery, so it wasn't anything that, I was super, scary. I mean, it was scary, but that was really it other than, high ankle sprains playing football. Those were kind of my interactions with healthcare. But I would say growing up, my parents really instilled in me just kind of the hardworking aspect of just life because they both worked in construction or real estate. So if I wanted that, new skateboard or that, new stereo system, I was going to the job site to really, earn it because that was not coming free. But just healthy living, my parents weren't buying me all the sugary cereals or the Pop-Tarts that all the kids wanted. I did have them an occasion at friends' houses, but, both my parents just always, were going to the gym. I was in daycare and I remember being, 13, 14 years old. Like, when can I get a membership? Because I want to work out with dad. And so I've always kind of lived a healthy lifestyle or tried to. And then, of course, you get into, college. I always wanted to play college football, played running back, Marion High School, had a good career there. Wanted to take it to the next level, ultimately decided on co-college. Didn't know what I was going to do, like most college kids. I was debating on law enforcement, architecture, engineering, but once I got into the football program, I got to know our strength conditioning coach pretty well, and he was a great guy. I think him and I probably butted heads a little bit at first because I felt like I was ahead of the game as far as lifting weights go because I've been doing it my whole life. But he was always correcting me, and it just drove me nuts. But him and I became really good friends at the end of it. And so I was kind of like, I want to do what you do. And so at Co, I studied physical education with an emphasis in strength and conditioning. So still immersed in the health and wellness space. Ultimately wanted to be at the collegiate level, train college athletes, had an opportunity after graduation to work for the University of Iowa in the football program there. Awesome experience from a personal and professional standpoint. It wasn't just a walk in the park. I had to do book talks. I had to learn all their coaching methodologies. Because everything that they were teaching all of the players, I had to basically learn, word for word, how they were critiquing their lifts, whether it's hang cleans, back squats. I mean, I didn't just show up and, hang out with the guys, let's just put it that way. But it was an awesome experience, but realized I needed to get to work. College loans were definitely knocking on my back door. And so I was kind of at a crossroads, and one of my good mentors from college. He was my first year seminar teacher, kind of guided me throughout my college career, make sure I was on track. So I had some conversations with him, and he was like, well, Greg Dunn might be hiring, who was, the agency owner of Benefit Solutions, which was also who Northwest Partners bought and who we are today. I knew Greg for my time at Co because his wife was actually one of my professors in psychology. And then I also just, with my construction background, I did some odd jobs for him for some summer money. So I was like, he's a great guy. He might be a good boss. I just don't know what the hell he does.
He is a great guy, by the way.
Yep.
Yeah.
So I actually had some conversations with some of his employees at the time were also former co-graduates. So he was always looking to hire good co-people. And so learned a little bit about what their day-to-day was in insurance, and was like, all right, let's give it a try. So he hired me. Wasn't even licensed. I got my license within the first week or two of being on the job, and they don't hand you like hey, here's benefit advising 101 guide on how to conduct your business.
Yep.
You just kind of learn by doing. So I got some small group business, and just started, learning and listening. And after a couple of years of doing that, you start to build up your clientele, and it just seemed like, I would say, maybe a year and a half, 2 years in, I was kind of like, okay, I'm not everybody's best friend every year, having to, go out and say, you say, hey, let's meet. I've got your renewal. And they
Here's your
respond
sickle.
with, they respond with, well, how bad is it?
Yeah.
And it's just like, we're always delivering bad news on behalf of some of these carriers that we represent. And it's like, I understand why they hire insurance agents to have to deliver the news, so they don't have to. So instead of just, accepting it is what it is, I was just like, there's got to be a better way. And I thought, well, maybe if I move to larger groups that, there's more flexibility, more opportunities to make an impact on their business and their people and the health of their people and everything. And quickly realized, even in the large group space, that no one was really doing anything different. They were just taking on the increases. So, I think a lot of what Community Connected Health and our mission, our principles is built on is, what Dave Chase talks about. He co-founded Health Rosetta and wrote that book, CEO's Guide to Restoring the American Dream, which, by the way, I would tell any executive or really any person to read that book to really get a good insight into what's happening under the hood in our healthcare industry. I always tell all of my employer clients that, they're an engaged buyer that once they want to learn more, to read that book. And so I started connecting with other Health Rosetta advisors, and I'm super grateful to have met a lot of those folks because they were, just taking time out of their day to meet with me, kind of share some insight on what's working for them. And I was like, okay, there are some people that are doing things differently out there, maybe not in Iowa or within my organization.
Right. Yep.
So that started kind of leading me down that path of, let's connect with other people that are trying to make a difference in healthcare, because taking increase after increase is not sustainable. I mean, what deductibles are now since the passage of the Affordable Care Act, what premiums are now since the passage of the Affordable Care Act, it's outpacing workers' earnings, inflation. It's just one of those things that people are like, well, I got to have it. So you can't afford to have it, can't afford not to have it, unfortunately. But there's a lot of positivity that's coming out of, this broken system, because there are people that are starting to say enough is enough. And it's not just you and I, it's the provider community, it's, various hospitals, it's mental health providers, it's primary care providers, it's pharmacists, it's the whole system. So even though we may be talking about a lot of dysfunction or disconnect in healthcare, because there's a lot of it, we'd like to also share, how we're trying to connect the dots with the right people, because, again, going back to Dave Chase and, that building a community-owned health plan mindset, every community has people in the community. They've got businesses in the community. They've got healthcare in the community for the most part. And we all just need to, come to the same table, work together, because we all need each other at the end of the day for a thriving community.
Yeah. Yeah. Wow. That's just awesome. And, we kind of have these similar paths of, we both have health in our background and experiences in this. And to me, as I'm looking back just really over the last 5 years, where I kind of see this great leap forward for mankind and what's happening in our industry, the one dream that's really come true in all this for me is just that finally I'm at the table with the people that I've been trying to serve, and again, which is the healthcare profession, hospitals and providers and the pharmacists. We have basically a population of people who are functionally uninsured. I think the average deductible right now is something like $6,000. We were looking at some reports this morning that annual cost for this employer is $20,000 a year. I've seen it as high as $43,000. I go back to 1988. I have a brochure on my desk from the Iowa Medical Society back in the good old days when you could actually have a true group
$100 deductible, baby.
$100 deductible. They had actually it was a $250. It was Protector $250, $500, and $750. You were really a risk taker at $750.
There's not even emergency room copays that low anymore.
You pull in the parking lot, it's $5,000 at these places. It was like $188 a month for a $250 deductible plan. Fast forward, we're seeing a family of four in this country that's costing them $26,000 just in premium. And then when you add in their out-of-pocket maximums, you're all the way up to $40,000. Is it any wonder people are sitting in these employee meetings saying, looking over their shoulders to make sure their employer's not hearing them, but they're telling a coworker, the only reason why I'm still showing up for work is I need my health insurance.
Yeah.
And so people said lower Medicare to 55. Well, if we did that, the world would go into a complete shock because you'd have a lot of people who would retire tomorrow. And it's almost like we've been enslaved by this thing. And the other thing is on my side of the table, which is our side, by the way, we've done a really poor job. We've made up our own language. And I don't think that Logan paid a copay for his coffee this morning. I know you don't have a mic, but he's shaking his head no. Certainly didn't pay a deductible or not a pocket maximum. And I remember walking into an employee meeting at a doctor's office, and the lead physician said, "Here comes the doctor of death."
Referring to you?
Yeah.
Hey, at least you got doctor in your title.
Oh, well, as long as I can, make people laugh, right? That's the deal. And I said, oh, I know. But again, going back to what you said, it's like, I'm just sick and tired of the same answers. And when you have these CFOs or people, the owners going, all right, how bad did you hit me this year? And when you tell them it's a 3%, they act like that's a victory.
Yeah.
And they've been so conditioned to the status quo. It's, the frog effect, right? Where you heat the frog up slowly in the pot of water, and next thing you know, they're 500 degrees and they're boiled to death. And so we've seen victory lane, and some of the things that we're dealing with right now with our clients is, again, the other side of the coin, as I said earlier, is just that we are now sitting at the same table as the providers in our meetings. And so we'll kind of unpack that a little bit here. I know it's in the spirit of time, but...
Well, that's probably the difference of, you've worked with the Iowa Medical Society and, other physicians groups growing up or just in the industry. But maybe the difference from then until now, maybe, it wasn't that big of a problem. It was probably a problem, but, you didn't have to seek alternative solutions. But now it's getting to the point where employers can't just bury their head in the sand. Even from the provider standpoint, they can't bury their head in the sand. I think they have one of the highest suicide rates in the country. Yeah. So it's just there's problems everywhere we look, unfortunately. So again, just goes back to what I said. We all need to be sitting at the same table, and that's the difference now. One of my favorite conferences is the Free Market Medical Association. There's not a lot of brokers or insurance people there. which is kind of nice because, like I say on, LinkedIn all the time, more insurance is not going to fix this problem.
Right.
Insurance is just a middleman. It's the biggest, wealth transfer, legal wealth transfer in, our society. And we just need, a more connected, health plan and benefits and getting people access to care. We need to remove the barriers to care because that's another problem, because as an employer gets faced with those renewal increases, what do? They raise deductibles. They go to limited networks where people can't go to the doctors they want to go to. They ask their employees to pay more. There's a whole slew of things that they do that ultimately pushes more costs off to the employees, which I can't blame them because it's eating into their profitability and they have a business to run, but at what cost? And so now people aren't going to the doctor as often as they should. They're not taking their medications as often as they should. Nope. So, one of my, favorite benefits to, put into an employer group plan is direct primary care because the feedback that we're getting from employers and employees and their families
Other side of the coin. Yeah.
This is what healthcare used to be.
Yeah. Get rid of the insurance, but don't get rid of the DPC.
Yeah. And I was talking to someone today, and I've seen it on LinkedIn, but people talking about, well, what if we used our auto insurance every single time we filled up our gas tank? Or we used our auto insurance every single time we got new tires or new wiper blades. What would our auto insurance look like? And it's like, it's the same thing in healthcare. Like, we use it for every little thing, and insurance is there for the catastrophic. But we need to double down on the preventative and, primary care side of things to reduce on, the catastrophic. Because now that people are avoiding going to the doctor, and I mean, we saw it during COVID, people weren't going to the doctor as often as they should, catching things late. And so if we can just invest in the primary care, preventative care, overall wellness on the front end, then we're not having to talk about some of these catastrophic things like cardiovascular disease, cancer, transplants, yada, yada, yada.
I couldn't agree with you more. And the evolution from my side, we went from comprehensive major medical, then to PPOs, and then to HMOs, and then they came out with health or reimbursement accounts, and then HSAs, and again, the land of acronyms. We got a new one called DPC, and I spent a lot of time in wellness. Wellness, if you're a company with 1,000 or 2,000, you might be able to get some credibility there if you don't have turnover. But this DPC, just kind of maybe a little background on the DPC. Explain to our loving listening audience, because I actually had a healthcare system ask me today, you keep saying DPC, what is this?
Yeah, we got to be better about that.
Yeah.
Because we will probably talk about certain topics.
Take her down to the fundamentals.
So direct primary care, it is a membership-based model. Or just cash-based direct pay. There's no insurance involved. However, there are some direct primary care doctors that we've come across that run more of a hybrid approach where they will take some insurance, but they would prefer to work on a membership base. So your direct primary care fees might range from $50 to $100. Mm-hmm. They provide a long list of services from preventative care to urgent care, labs, sometimes x-rays. I mean, really 80 to 90% of all the care you'd ever need throughout your lifetime for this one flat fee. And the issue with the big system primary care, I mean, the last time, I tried to schedule a visit with a big system.
You're not alone, don't worry.
It was 2 to 3 months.
Yeah.
And so it's like, if I'm sick, which I wasn't, but I was just trying to do, preventative care. I'm sick today. I'm not sick in 2 and 3 months. Like, I can't predict that. I need health care now. And so, they have panel sizes, I think, in the data and articles that I've read, anywhere from 2,500 to 3,000 patients. Yeah. So that's why you're seeing, this delay of being able to be seen. And that's why you're seeing the limited visit times, 7 minutes or less. Mm-hmm. And then they're usually just referring you on to, some specialist. And so with direct primary care, I would say that most of their panels are, 400 to 600 patients. So much smaller panel sizes. They can get you in same day or next day appointments, or, hey, how about this? You don't even have to go in.
Yeah.
They can just do telemedicine, or you can text them, you can email them, and just get access to care that way. And they've got longer visit times. And, what I've also found with some of these direct primary care relationships that we've cultivated is a lot of them are on the preventative side. From a lifestyle standpoint, what can we do to, or reverse disease instead of just give you a pill?
Yeah.
Because,
Crush the pills, please.
who was that guy that was it with Smart Scripts where he was doing the pill pack type things? And he said on average his patients were on like 7 meds at a time. And it's like, some people get prescribed a medication and then a medication for their medication because of the side effects. And so I always encourage everyone, like, hey, ask your doctor, what can I do from a lifestyle standpoint to, potentially, reverse whatever you're dealing with. Obviously, there's always a time and place for medications, but, whenever you don't have to take a pill, obviously that's money in your pocket, but.
Well, it really is part of that ecosystem. And it's really easy for us to beat up on the insurance industry, and we made up our own language, and people are frustrated, and including the brightest physicians in the world say, I just don't understand this garbage. But it's a reminder, again, and just as far as our pathway and our journeys in our lives, of striking that healthy balance and understanding that we have to take care of ourselves. And so my challenge to everybody when I talk about these principles is like, we need better patients, and I don't mean virtue. And we need better consumers of healthcare. And the beauty of that DPC, going back to that, is that when you think about a subscription-based model, and I think your analogy of Netflix is brilliant. It's like, well, you can watch 1 movie a day, or you can watch 100 a day, right? You're paying a subscription fee. So these primary care doctors, God bless them, they are burned out from a system. We're even seeing, you mentioned the Free Market Medical Association, where when we had 200 resident physicians, or people or doctors that were in med school saying, I want to understand what the new thing is, because I don't think I want to be in the system. And it's
no one wants to get in family medicine either, because they're being told they need to specialize.
Yeah, right. And
which is hurting all of America. Right.
And med school for a primary care physician is the same cost as it would be for an orthopedic surgeon. So if you're looking at the money, right? So when you look at this direct primary care DPC, and it's coming to a theater near you. It's here in Iowa. We've had some incredible expansion of the Free Market Medical Association and Community Connected Health just because of the primary care side of it. But when you think about it, you have access to this. It's not 24/7, although there is a clinic in Des Moines that does this. You got urgent care, you've got your wellness, you've got you might need a medication or a lab or an x-ray. A lot of these DPCs have it all in one box. And so 80 to 85 or 90% of your care is taken care of at that point. And so these subscription fees that we're talking about in our custom plans, we're baking those fees into the premium equivalents. And so that, employers love to see, what's my worst case scenario and how does this all work when I'm setting up my contribution strategy for my employees. We bake that in there, and what we love is our underwriters that get it. And the recent legislation, the Big Bad Beautiful Bill, also known as the OBBB, thankfully we got an extra letter in our acronyms these days. It actually speaks to DPC and high deductible health plans, and now that they can be allowed under HSAs. And so I think the broker community is going to start getting phone calls. Yeah. And
what is this DPC?
Yeah, what's this DPC? So it's really energizing me, especially today. I'm excited to be here, but this DPC, I think, is really going to be the future, and I think you're going to see more people get into primary care, more professionals, and I think you're also seeing, we've run into DPCs that are run strictly by physician assistants. Mm-hmm. We have one, right? And we've seen one out in Western Iowa, in Audubon. we call it little clinic on the prairie, right? Is that our joke? So, yeah, very, very fascinating and very exciting because, again, we're seeing the other side of the coin because when employees and members are saying, I love that I had a same day, next day appointment and I paid zero because everybody
no
remembers
co-pays.
zero.
They didn't have to use their insurance card. So, I mean, what's the equation here? No insurance, no barriers to care, no middlemen. It is direct care and connecting that patient to the doctor, which is the way it needs to be. And now the doctors don't have to answer to an insurance company on, what tests they can do or can't do. And I mean,
the claim doesn't hit the plan, right?
Yep.
You pay a subscription fee, you can use it 100 times a day. They've agreed to a fee, and so it's not hitting that plan.
Yeah, I mean, from the employer perspective, I mean, the cards are stacked against them. I mean, even the employees, the cards are stacked against them because you work with these insurance companies and you're giving them a big pile of money every month or every year, and it's like, what are you getting back? It's in value. And a lot of times, obviously they're paying more year after year after year. And so, I mean, these insurance companies are reporting record profits. And so just follow the money. Yeah. And it's not you or I that are making a ton of money off of, rising, premiums. However, we do see some brokers that are paid off of a percentage of premium. So employers, watch out for that. Make sure that they're not being compensated based off of the performance of your plan. As your costs go up, their commissions go up. But yeah, these insurance companies are recording record profits, and it's like, at what cost? That's hurting the profitability of the company that is hiring them. That's creating a barrier to care for the employees when they go to use it because of increased expenses. And then from the consumer side of things, I mean, trying to you talked about, paying a copay for, your coffee or things like that. It's like all these healthcare prices or for prescription drug prices are usually hidden from the patients or, consumers. And, I think we're going to see more transparency around that, which is good because with transparency, there can be more consumerism. So I think we'll get to the point where it's going to be an Amazon shopping experience at some point where you can search a product or a CPT code or a service and it's going to pop up. You're going to get star ratings based off that facility and that doctor. And you're going to know exactly what the price is. And that's going to help the industry quite a bit.
Yeah, I think the waterfall is about to be unleashed. And you look at big pharma and, the impatience we have. And we can say that's the way we are as Americans. But if we're sick, we're ready to drain our 401ks to feel better. And so it's fix me now. And we're ready to just throw an ungodly amount of money into an emotional transaction, as I like to call it. Healthcare is an emotional transaction. And for the brokers out there listening, we all know what we're talking about. People call you and they want to, they're mad they couldn't get a drug or they have to do a prior authorization. But I do believe the waterfall is going to be unleashed. I think there's more and more. And God bless the doctors. God bless our healthcare providers for the work that they do because they are special people. And they're not the ones that are in charge of the charge masters or understand what's going on. They're just trying to keep up with the Joneses. And so I think there's a lot of other cool things. Oh, geez, are we only on page 1 here? Oh, gosh.
Yeah, like
Logan's
I said, we could just do this all day long. But maybe we can, close things out and maybe tell the listeners, what they can expect. And honestly, I don't know what they can expect because we're just kind of doing this thing. But, I think we envision, having some of our partners on with us and, share their expertise. Some of the healthcare providers in our community, hospital CEOs, orthopedic center CEOs, direct primary care doctors. We've got some good partners in, EAP programs. Thinking about Covenant. So just bringing on people that are, moving this mission, providing healthcare. Again, connecting with patients in this disconnected healthcare world we live in. So I'm excited to see where this goes.
Yeah, well, I'm excited not to have to talk so much, but I am going to sign up to be our first musical guest on the next show. I'll have a better monologue, but no, I'm just really appreciate and just honored to have this opportunity to just share my experiences because, again, it's been a long journey, and persistence pays off.
Yeah.
And we know being nice is expensive sometimes in life, but it's worth it.
Yeah. Well, I mean, it's hard to meet with every employer in Iowa or across the fruited plain. We're only just 2 people, but there's a whole ecosystem of people like us, or the top 1%ers that are really trying to create change. Because I feel like also with individuals in our position, it's easy just to skate by, collect a commission, and just continue down that path and say it is what it is. But what does that solve? I think what I've seen people, saying on, social media or LinkedIn, do you want to be a part of the problem or do you want to be part of the solution? Yeah. And I think, our missions are aligned there, where we want to be part of the solution and trying to connect with other people, like-minded people that are also, want to jump on the wagon with us and try and create this change.
Yeah, I think having some case studies, because that's the thing we've been talking about. It's like these ideas sound great. People are saying it's too good to be true. It's hard to put your skepticism on the shelf. But when we hear the other side of it, where someone's crying on the phone, and when they say that they didn't have to pay their deductible or they're out of pocket, this is happening in Iowa.
Yeah.
And I just felt like we were 5-10 years away. Time goes a little faster at my age than maybe most, but you're right. I think we just have a group of folks that are happy to criticize what's going on and focus on maybe the negativity of it. But this is not for the faint of heart. Yeah. It just isn't. You're going to work hard, and we're excited to work hard with you.
Yeah. Well, I think this is where we say like, share, comment, leave us a 5-star review or a 1-star review.
Yeah, I'm buying.
But if anybody, in all honesty, if they have any ideas of people to bring on, that would help move these conversations along and really want to take action with us, reach out. Love to have you.
Great to see you, bud.
We did it.
We did it.
All right.
Finito.
Appreciate you.
Appreciate you.